Welcome to Kidney Cancer Unfiltered. I'm your host, Anna Maria Scaccia. In today's episode, we're hearing from the Sanders family as they share their journey through pediatric kidney cancer. We'll discuss signs and symptoms, differences in treatment for children and adults, the life-altering impact on the whole family, and the financial challenges they've faced. You'll also hear from our young survivor, Dre, who shares his hopes for the future in his own words. Hint, he plans to turn pro. Thanks for listening. Let's begin. Well, Alex, thank you so much for joining us on Kidney Cancer Unfiltered. For our listeners who may not know your story, can you please just tell everyone who you are and what brings you to this conversation?
Sure. My name is Alexandra, and I live in Buffalo, New York, and I'm joining the conversation today to talk about my son's journey with pediatric kidney cancer.
So I'm grateful that you're on because we often don't talk about pediatric kidney cancer, and I know that is a conversation that we want to start having because it does affect so many children. I'd love to know more about your son's story from the perspective, obviously, of his caregiver, his mom. What were there signs? What were the first, inkling that something was wrong? Like, just take us kind of through that journey.
Sure. So my son's name is Andre, and he goes by Dre. And when Dre was 4 years old, on Labor Day in 2019, that's when he was thought to have some type of pediatric cancer. So to give you a little bit of the backstory, so I'm an oncology nurse. I was working at our cancer center in Buffalo, New York, and my husband is from Miami, Florida. And we had moved to Florida the summer of 2019, about a few weeks before we found out about Dre's diagnosis. So it was a whirlwind because of our relocation. And at the time that we had moved to Florida, we were sick with like cold type symptoms, and Dre had like cold type symptoms too, which we had thought that was something from mom and dad. But he had kind of like a low grade fever that lasted a couple days. Ended up going away, started preschool, doing extremely well. About a month prior, he had had his 4-year-old well checkup. Everything was perfect. And a few weeks into us moving to Florida, we had a hurricane that was supposed to hit the town right next to us. And my husband's backstory growing up in Miami is in 1992, he had lost his home to Hurricane Andrew, which was traumatic because he was 10, his brother was 5. So his first thing was, we need to head up north, and we need to get away from this hurricane. That took us to Atlanta. We thought we'd be there for the weekend, and I went up to Atlanta with 2 healthy children. And overnight, Andre had woken up out of his sleep with abdominal pain and with vomiting. And I'm like, something isn't right. I had taken him to the hospital, and we were told, it was overnight. He ended up falling asleep there. It's probably a stomach virus. Well, that day he did not get better, and we took him to a different hospital the next morning, and he looked sicker at that time. He had a fever. On his labs, some of his counts were elevated, and they thought it was appendicitis. But everything especially with it being a holiday, this was on Labor Day Monday, they wanted to act fast in terms of, the surgeon was like, I'm confident based on his counts, what he looks like. He was complaining about hip pain, but he was very guarded with his abdomen. They ended up not doing a scan and taking him emergently to the OR, thinking that his appendix had ruptured. So, I felt at peace during the time that he had went into the OR, because my first thought was, the problem is getting taken care of. And I'll never forget it. Like, it's a beautiful sunny day. It's a holiday. So it's just my husband and my oldest son, who's 5 at the time, and myself sitting in the surgical waiting room. And I could tell by the surgeon's face when he walked in that something was wrong. And it was with the scope when it was in his abdomen. They ended up doing the appendectomy that they saw with the camera, the kidney tumor. And given his age, because supposedly it's about, around age 4 to 5, it's boys more than girls for some reason too. Wilms tumor is the name that they call pediatric kidney cancer. The medical term for it is called nephroblastoma. So, they assumed that looking at his age, the presentation, all those things, that it was likely to be pediatric kidney cancer. So we ended up getting admitted to the hospital we were at, with all the things that we endured. We ended up being at a really amazing hospital called Children's Healthcare of Atlanta, or they call it CHOA. They were absolutely incredible. And here we thought we were going to be recovering on the surgical unit. We ended up getting up to the oncology unit. So that was a whirlwind for me, especially being an oncology nurse. How things progressed from there. We ended up being in the hospital for about like 11 days. And it was the Wednesday, the Wednesday after Labor Day that they ended up taking him to the OR and having the surgery. So in kiddos, they do instead of a radical nephrectomy, they do a radical nephroureterectomy, which means that they take out the kidney and the ureter too. And the other great thing too, because they know in advance that kiddos will need treatment after they have surgery, that they actually put the port in at the same time that they take the kidney out too, which, I appreciate that thoughtfulness, because then it's not another surgical procedure. They're doing both things at the same time.
What are the signs of Wilms tumor for parents to watch out for?
So blood in the urine is something to watch out for. A distended abdomen, but it could also be like a particular side of the abdomen. I have seen that in other cases. And then if there's any type of like back pain in terms of, the kidneys, sit in the back, they call that more flank pain. Fevers, or that can't be explained, or weight loss, even too. Like if you notice that the belly is getting bigger, but overall they look like they're losing weight. The other thing is abdominal pain. Of course, like abdominal pain could be lots of things, but that was the symptom that my son experienced, where we learned later, of course, the reason what was causing the abdominal pain.
I would love for us to talk more about the treatment for your son and pediatric kidney cancer in general. How is it different from because most of the survivors listening are probably coming from the adult survivors perspective, and we know. So what does that treatment look like, and how is it different from adults?
Sure. So I can speak to this more specifically because prior to my son getting diagnosed and after he got diagnosed as well too, I work as an oncology nurse coordinator, and I work in a urology clinic. I take care of adult patients with bladder and kidney cancer that are typically advanced or stage 4. My son was diagnosed with stage 4 Wilms tumor. We found out after the surgery that he had positive margins. It spread to his lymph nodes, and it spread to the base of his left lung. So we received a sort of map of what his treatment was going to look like when we were in Atlanta, where we knew that we would need at least 6 months of chemotherapy. And we knew, because we had positive margins and spread to the local lymph nodes, we knew that we would need radiation to the flank as well. That is typical for Wilms tumor treatment. Now, the other thing too is they do genomics in terms of testing on the tumor. And we learned from that genomics testing that kiddos can have either a chromosome loss or chromosome gain. And he ended up having a chromosome gain, which was thought to be a more aggressive factor of the diagnosis. So what that meant is taking into consideration, where the cancer had spread and this aggressiveness factor. When we had first initially thought that it was going to be 6 months of treatment with 3 different chemotherapy drugs, it ended up being 9 months of treatment. It was radiation to the flank where the tumor was. For him, it was his left kidney that was affected. So that was, I believe, 6 radiation treatments. And then because of the spread to the lung, they ended up doing whole lung radiation treatment. I believe that was 8 treatments. The regimen that he ended up on was called Regimen M, and it consisted of 5 different chemotherapy drugs. Sometimes he would go in just, once a week for an infusion, and some weeks he would have treatment all day, Monday through Friday, because, just like with adults with one kidney where you have to protect that kidney and the kidney function, same with kiddos too. You're doing extra hydration before and after. The other thing that's different about adult versus pediatric kidney cancer is that the cells in the cancer are different. Like how I said that pediatric kidney cancer is nephroblastoma. Adult kidney cancer is renal cell carcinoma, where you could have different types of cells in the renal cell carcinoma. For my son, you could either have favorable pathology, so it's like favorable Wilms tumor, or you could have non-favorable. Non-favorable is considered more aggressive. My son ended up with the favorable Wilms tumor, but again, we did that more aggressive treatment regimen because of the information with doing the genomics testing.
How is stage 4 in a child different than stage 4 in an adult?
I think what's probably different is the treatment, in terms of the treatment for pediatric kidney cancer has been around a lot longer than the developments that, we're experiencing on the adult side. We just in probably the past 5 years in kidney cancer, like we've seen in adults a lot of advancements, where in pediatric kidney cancer, for decades we've been using the same treatment. Thankfully, they do have pediatric kidney cancer specialists that are doing research on it. It's because, genomics in terms of like testing on the tumor is a new and coming field, that's helping to dictate treatment, and treatment options, where, for Dre being stage 4, again, with him having the favorable pathology, I remember them quoting his prognosis in like the 90 percentile, and that's because, they have vetted treatments that they've had for a while, where, they know the outcomes because they've been tracking that for a long time. But just to speak in general for pediatric cancer, and not just pediatric kidney cancer, there's some disease sites that have a 0% chance of survival, where, there is much more funding needed to do much more research, because again, children hopefully live for many more decades. So, what's really needed is advancements for, not only safe treatments, but of course, effective treatments too. And from a safe perspective, I mean treatments that don't predispose your children to a secondary cancer, and in the adult setting, we've had a lot of advancements in immunotherapy. The other thing I don't think I touched on earlier is that in pediatric patients, chemotherapy is used because, again, there are different types of kidney cancer cells, where in adults, we don't use chemotherapy. We use either immunotherapy, targeting the immune system, or we're using a more targeted therapy in terms of different types of targeted pills, which target the blood vessels. So, that's another difference between the two.
Well, before I ask you my next question, I want to know, and I'm sure listeners do too, how is Dre doing today?
Oh, so Dre finished treatment, the 9 months of treatment in May 2020. That was another whirlwind because, we went from, moving across the
Yeah.
country to pediatric kidney cancer treatment to then it was the pandemic, towards the end of his treatment in May 2020. So he finished and rang the bell in May 2020. And how things looked at the beginning was we would go every 3 months for labs, a CT scan, the whole thing. And we are now 4 years, no evidence of disease as of May 2024, and he is on annual checkups now. So in May of 2025, that's when it'll be 5 years, and we can't wait to hear that he is cancer free.
That's amazing. I'm so happy to
Thank
hear
you.
that he is cancer free. Now, your background as an oncology nurse,
Yes.
how did that help you approach the situation? I'm sure as a mom myself, I think our sons might be around the same age.
Mhm.
Mine just turned 9 in May. Um, I couldn't even, going through it twice myself is one thing, but like having to see your son or your kid go through it is just I couldn't even imagine
Mhm.
just all the emotions. But being an oncology nurse, did that help you kind of not, I don't want to say compartmentalize per se, but
Mhm.
maybe put that, your reaction as a mom kind of into a perspective to help you take him through the treatment?
That's a great question. So I think one of the things like that's unique to moms is like your child best.
Yes.
Like I knew that there was something wrong with my son. I remember crying to the surgeon that was coming in to evaluate him saying he's in so much pain. I can't pick him up and hold him. Please find out what's wrong with my son, and
Yeah.
um, you know, from from that initial time of him, being a patient, I think that my nursing knowledge, not only just nursing, of course, on oncology knowledge too, is just, helping to prepare him for what he had to go through, whether it was getting an IV placed, getting a test done, I knew as a medical professional what he needed to go through as a patient. And my Dre and both my boys are different. So Dre is my extroverted one. He's very bold, says whatever's on his mind, loves out loud,
Yeah.
all those things. Okay, but he also is the type of person that if he can set his mind to something, he can overcome it. So
Mm,
I would tell him what he had to go through, whether it was a poke or something. He would ask me questions, but you could tell like he was like visualizing it,
mm,
so that he could get through it. And he was the child in the clinic when he heard another kid crying, because when they received treatment, you're kind of in a more open space where there's like curtains
yeah.
between the chairs. He would want to go over to that child to comfort that child. You know what I mean? Because that's just
Yeah.
him and that's just his heart. Initially, um, I was grieving the first couple days, especially, and I think what was hard too with our circumstances of being out of town, my son, our dog, and my husband were all at the Ronald McDonald House. Thank God for the Ronald
Yeah.
McDonald House and the care that they provided us. But um, I was in the hospital 24/7 with Dre as the caregiver. And the first few days I could not stop crying. I mean, we went down for a CT scan. I'm just crying. Thank God
Yeah.
for the child life specialist who was caring for my son because I needed somebody to care for me. But I had to first get that like grieving out.
Yeah.
And the one day Dre caught me crying in his hospital room. I think I thought he was sleeping and he wasn't sleeping. And he said, "Mom, go get a towel and wipe your face." Because like my son was not crying, he was not grieving for himself because he
Yeah.
didn't have the whole understanding, of course, that I had. My response was like, my life is forever changed by this,
Hmm.
because this is not a blink of time. This is an entire life change from
Yep.
here on out. And once I got that encouragement from him, Mom, I need you, to be strong for me or whatever, that really just changed my mindset, and he truly led the way on that.
I love that. I love that you're both able to provide that support and care for each other. Now, what about the rest of the family in terms of support, in terms of his care? How was his brother and father involved in the treatment, in the caregiving, and how they are today? And
So, what was hard at the beginning was the fact that we were separate, and my husband
Mhm.
and I were sort of like grieving separately. And, also we had our 5-year-old son with us too,
Yeah.
and, I think that that was probably the hardest time for us was being apart. I think that once we got in the same place when we had come back to Buffalo, we never went back to Florida. We moved right back to Buffalo. We didn't live in Florida long enough to even be established there,
Okay.
and for my oldest son, I think what was tough was the loss of normalcy.
Mm.
And I think what was also hard was seeing his brother go through hard things. I think that where things got a little bit better for us was getting back into a routine. And for my son, he had started kindergarten, my oldest son, he had started kindergarten when we were in Florida. So we had a little break while we were in the hospital. And then we, of course, had to get an address and everything when
Yeah.
we moved back to Buffalo. But him getting back on that schedule was good for him. Also, with our son too, we also included him, and he would come to appointments with us at the cancer center. The cancer center is really great about letting siblings come because, he needed to know and understand too what his brother was going through. Because for my boys, if he didn't know what he was doing, that would have made it harder for
Yeah.
him. For my husband, we had to make some, decisions as a couple because we
Mhm.
needed health insurance, for my son's treatment. So I ended up going back to work part-time, eventually full-time, probably when he was in the middle of his treatment, once I knew things were going okay. And my husband was the 24/7 caregiver.
Okay.
So, and he's a non-medical professional. So, he learned a lot, going through everything that my son was going through. But I think a big theme for our family too is just our faith, and
Mhm.
leading into that as well. And our togetherness. We're a very tight-knit family, and we truly got through the whole thing together.
What does that financial strain look like for families, for your family, but for families in general?
Thank you for asking that question. I think that's something that might be different about childhood cancer treatment versus adult treatment because there always needs to be a parent with the child,
Mhm.
and depending on what their treatment looks like, whether or not they're in the hospital 24/7 or whether or not they have to be in clinic all day, that affects a parent working. So many times if there's a two-parent household, there might be one parent working while one parent is taking the child to the appointment. So then if you're a two-income household, then you have the loss of income, but then every single time you go in for a visit, if you have a type of insurance with copays, you're going to have a copay every single time, which can differ. Those things all add up. Then, you also have, if you have diet changes, depending on
Mhm.
the type of pediatric kidney cancer, diet changes that increases, meal costs and things too. The other thing that people might not think that add up to is parking to go to the cancer center,
Mhm.
parking every day, sometimes every time you come into the hospital. All of those costs add up. Additionally, as a child cancer family, if you have to travel to another cancer center for treatment. If your home center is recommending that you go someplace else for a specific treatment or for a clinical trial, then you also have travel costs too. It can be extremely expensive to have cancer in our nation, just because of the nature of working and how much insurance and copays and things cost, where that can take a huge toll on a family. So shout out to the organizations that give help for travel, give help for meals, give any type of financial help in terms of paying essential bills. That is those are things that pediatric cancer families need, and of course we'll be more grateful for. So thank you for asking that.
Of course. And I'd imagine that it's even compounded when you have, multiple children, or if you're in a single parent household, just all those bills just keep racking up. Even when you have excellent insurance. I think that's one thing, both for pediatric cancer and adult cancer, that people may not realize. Even when you have excellent insurance, those bills do really rack up. So I appreciate you even raising it and giving more context to it, because it's something we need to work on in this country. So in terms of your husband and you basically switching on and off in terms of the care, how did you help support each other as you were taking on those roles, right? Like, if you being the primary caregiver at first and then him becoming the primary caregiver after you went back full time, how are you able to support each other?
I think one big thing for us as a couple, we'll be married 13 years next week, and we're best friends too, was keeping communication open, being able to be there when we needed each other emotionally too. If we needed to, cry in each other's arms, we had that refuge in each other, especially being there together for like scan days or like important doctors appointments too. Just our presence, for one another, I think truly helped us. For switching on and off with caregiving with me working, it was, having everything organized and laid out in terms of like medications or things like that. We had to teach our 4-year-old how to take pills, because he had to take pills as part of this too. Like, that was a learning curve. We also had help in terms of Dre had a visiting nurse as well, which was super helpful. But I also have to say, a huge thank you to our whole childhood cancer community, because above and beyond, us and our family, locally in Buffalo, we have several amazing organizations. We have one that's connected with our hospital, that has support for the whole family. We have that's called Courage at Carly. We have another one called Camp Good Days. Which again is support for the entire family. We have Make-A-Wish as well too. And then we have another organization called PUNT, and that's PUNT Pediatric Cancer Collaborative. So, we have organizations that not only have supportive resources for us as childhood cancer families, when they do, events or, get people together, you have the whole family there. So you have dads that can connect with dads, moms that can connect with moms, siblings that can connect with siblings whose sibling is going through cancer treatment. And like, I feel like that was so helpful to us, to lean into our childhood cancer community, because this is our theme for our parents support group. We truly are stronger together, because it is a lot mentally, physically, emotionally, spiritually, financially, to go through cancer treatment. And that is not something that's unique to pediatric cancer. That is for our adult patients as well.
Now, for other parents, what advice would you give them if they find themselves being faced with a similar situation? What advice would you give them to going through the treatment, even before that, for understanding the signs and symptoms and like what to look out for? What would be your advice and tips?
Ooh, that's a good question. So my advice would be to, lean into your support system, make sure that you're taking notes during your doctor's appointments. I say this to my patients, and my patients would tell you this, to do everything you can to stay off Google.
Mm-hmm.
Ask your questions to your oncologist. If you need to search online, you need to go to scholarly organizations such as the Kidney Cancer Association. As an example, you need to go to .org websites,
Mm-hmm.
to get information, just because there is a lot of information out there. And then I think one thing that's unique to people is, how they best feel supported. Where some
Yeah.
people feel best supported in a support group setting, for some people that might be a lot. So I think one thing too is, to know yourself well and know what you need to support yourself, but also, your family best. So you have it in you to be the best advocate, not only for your child going through treatment, but to advocate for what your family members need to. A big thing that is probably not talked about enough with just a cancer journey is, the emotional toll that it has on a person, and how that can really affect mental health. So I didn't realize that I had PTSD until I probably, I don't know, maybe like a year or two after the initial
Mm-hmm.
diagnosis, because it's like you're kind of going through all of the motions,
Yeah.
up, we got to do this, this, and this. We get to this scan, we got to do this, this, and this. We get to this, point in
Mm-hmm.
time. And I think that when everything kind of like settled, and then I realized kind of like what was in me emotionally, I knew that I needed to care for that space. And I think that another thing too that families need when they go through this is some sort of outlet, in terms
Mm-hmm.
of what fills your bucket, what fills your soul, what do you need for you, because as a caregiver you need to make sure that you're doing at least something to care for yourself too, because 24 caregiving is a 24/7 job.
Yeah. Now, you had mentioned earlier that this is a transformative experience, right? Like this is a lifelong transformative experience. And I think us as adult survivors, we know that losing our kidney is going to lead to some changes. But at this point, generally, we're like all the way developed, we've gone through our lives. So for your son, it's completely different. He's not fully developed. He was very young. What are some of those transformations that you have to basically look at now, and that he has to look at, both as this kid growing up and coming of age and into adulthood?
That's a great question. And that is a difference between, adult and pediatric kidney cancer, because to your point, they still are growing and
Mm-hmm.
developing. One of the questions that we had when we had first met with Dre's surgeon was, we're a big sports family. So like, will he be able to play sports, And his surgeon was actually a college basketball player. And she's like, of course he can play sports. He just might need to wear a kidney guard. He needs to stay better hydrated than the average person because he only has one kidney too. And if we're in a setting where, they're saying he can't have a water bottle or something, like we're advocating for that.
Yeah.
He does wear protective equipment when he plays sports. He plays flag football, travel soccer just about year round, and plays baseball, and he wears that protective clothing underneath his clothes. How pediatric kidney cancer treatment affects organ function, though, is depending on the treatment that your child receives, when they're done with treatment, you're going to get some sort of like survivorship care plan. And part of that is the oncologist. We got a binder with all of this information. One thing
Mm-hmm.
I also love about my son's oncologist is she not only is a pediatric oncologist, but She actually also works in our survivorship clinic at the cancer center that I work at too. And she does our onco fertility as well. Those are all important things, to our adult patients, of course, but also to me as a parent for his longevity. And, you get information in terms of their risk, but also their survivorship and follow-up plan is looking to some of the specific things that treatment can affect in terms of like heart function. One of the chemos that Dre received can affect his heart function. So he has, periodic cardiac testing done. They also do a more comprehensive evaluation in terms of like lab work, in terms of checking like his thyroid level or his vitamin D level, for example. Additionally, the treatment that children receive, and this is something that you will frequently hear childhood cancer patients advocating for, is the treatment is actually carcinogenic, meaning that the treatment can cause cancer. So pediatric cancer survivors, they're at risk of secondary cancers. Radiation puts them at risk of secondary cancers, but also some of the chemotherapies can cause things like leukemia or myelodysplastic syndrome, for example, which suppresses counts. And, that's a thing that, I remember his last appointment, before he was ringing the bell, we had clear scans at the end of treatment. We were celebrating, of course, but I also took the oncologist aside and was like, okay, but what do I need to watch for? You know what I mean? Because it's the type of thing where I am aware of it, but I also can't live my life in worry, So, as a parent, I want to do all the best things for him from a just holistic, healthy standpoint in terms of, being adequately hydrated, getting exercise, getting healthy, nutritious food, and all those things. But I believe the statistic is that 95% of childhood cancer survivors, can have some sort of long-term health effect. Why? Because they have so much life ahead of them, thinking about, being diagnosed, for example, at 4 years old. So it is something that weighs on us, but it is something that, it's part of the oncologist planning, to make sure that your kiddo has close eyes on them for a very long time. He will have annual visits forever.
And I'd imagine you being prepared and knowing all this stuff that he has to do or that is going on in the survivorship plan really also sets him up for his care when he's an adult, right? When they make that unfortunate transition from being your kiddo to being an 18-year-old with real opinions and a job, I'd imagine like you being able to know this stuff and like really get it like an understanding of it also sets him up to be able to take care of himself in a really holistic and intentional, meaningful way.
Yes.
Now, in terms of support for him, right? You had mentioned the emotional toll. And I think, at 4 years old, there's a lot that you have to process that you don't necessarily know how to process. So what other additional support were you able to give for Dre for him to be able to go through the emotions of what he was experiencing?
In the hospital, whenever we were in the hospital setting and in our oncology clinic, they have child life specialists, which was super helpful in terms of they have all the cool things and to learn through play in terms of when your child has to get their frequent port accessed. It's they have something for them to practice on. He actually got like an Affleck duck, I remember too, that had like a port, where it's kind of like, not necessarily like normalizing it, but like helping them get through it. I think that I thought that my son would have more emotional things than he actually did, but this just really speaks to his personality. He's the type of kid who's like, what do I have to do? Okay, cool, done, over with, before Dre was ever, diagnosed with cancer or anything this serious, medically, he grew up, in a home where, we have a strong faith, where, he believed that, if I had a cut on my finger or I bruise my knee, I bring that to Jesus, and Jesus is going to heal me. And, Dre had that mindset and that belief as he went through treatment too, where we actually had we were getting interviewed for something, and he had said something like, my kidney cancer is all gone, and that was the week that we had found out he had his first clear scan, and that was like 2 months into treatment. And then when he had finished treatment, this organization had like played that video back or whatever. But it's like, I don't know, I just like I said, he's so strong, like not just like strong physically, but he's very strong from a mental and emotional standpoint. Like we've always told him, like, Dre, you are an overcomer. That's just him. And I think that, that's where I learned, but also grew as a parent, was, to tap into, his strengths too. And, with everything that we're connected with, we in our clinic, and probably many other, pediatric cancer places too, there's a whole psychosocial team. If we needed our psychiatrist, like we have a psychiatrist there, we have a social worker there. Again, we have child life specialists too. We have an amazing network, where if we needed those things are right there for us. So
that is amazing that you have such a wonderful resource by you to really be a source of support. Do you want to bring in your sons now, or
just be forewarned? You never know what he's gonna say.
I love my son is honestly the same way. Like, yeah. I like some of the things that come out of his mouth. I'm like, where did this even? But it's so wonderful seeing them be like little people, like getting themselves together.
Hi,
Dre. Do you want to introduce yourself to our listeners?
Yes.
Okay, so what is your full name?
Andre James Sanders. My Andre means warrior. So
what are you known as?
Andre the Warrior.
I love that. That is good. You're setting yourself up for a good career in the future, especially if you play sports. Like, you're setting yourself up for like a good career name. And who's this also?
This is my brother.
I'm DJ.
Hi, DJ. You said DJ?
DJ.
Well, I'm Anna Maria. I am the host of Kidney Cancer Unfiltered. I was just talking to your mom about your story, Dre, and I'd love to hear from you how you're doing. I hear that you're cancer-free.
Yeah.
And how you feel?
I'm doing great. Just hanging out, not playing any sports anymore. Finished all of them well. Won 2 championships this year. It was great. Had a fun time with my dad being my football coach, and it was really fun to have like really good teammates on all my teams.
That's awesome. And I love that you're still playing sports. That is one thing I hear as adults, right? Adults are always worried about whether or not they could play sports or build muscle. But the fact that you're doing that and like you're just letting people know, like, hey, just because I lost a kidney doesn't mean I can't kick around a football or, throw a basketball or whatever, is awesome. I wanted to know, your mom told me a little bit about kind of your experience through treatment, but how did you feel going through everything?
Like through chemotherapy and in the hospital?
Yeah, going through just getting the diagnosis, going through chemo. I mean, you were young, right?
I felt like really sick, and like my dad like bought me a couple toys to like cheer me up, and then my grandparents like came to the hospital like all the time to like read me stories. And like in the hospital every time, like in the morning, we go to a gaming room, and it was like really fun. And then we come back, probably
in
eat
Atlanta?
lunch. Yeah, in Atlanta.
In Atlanta. Mhm.
And yeah, it was really fun doing that, but just being sick and all that was like not really fun.
Mm.
I could imagine. Yeah. How did you and your brother like work together as you were going through treatment? Like what happened to your relationship? Like how did it bring you closer?
Yeah, it brought me closer to like defeating it, and I thank God. So, and also my brother and my mom, dad, grandpa, grandma, they always held my hand, and we always prayed and did all that stuff.
So what is the one thing that you would tell other kids who are going through kidney cancer too?
Um, I would like stick around with them, give them some advice if they're still going through what I had. I would just like give them advice of like what to do, like take deep breaths sometimes. Um, Maybe rest once in a while, and maybe try to stand up and get up, probably listen to music like that.
Music helped get you through.
Yeah, music did.
What was your favorite album that you listened to?
What was that song?
He loved the Spider-Man album at the time.
Yeah.
Remember?
Yes.
Miles Morales.
Yeah, I like that album.
Yeah, the Sunflower song from Post Malone. I remember you playing that on repeat.
Yeah, I can't.
I remember you listening to Bruno Mars at the time too.
I like his music.
I remember him dancing when he was in the hospital.
No, I love that. Yeah, you have to keep that energy up. Music is a really important therapeutic tool. Okay, is there anything else that you would want to share about your experience, your treatment, how you're feeling now, what you're doing now, what your hope is for your future?
For my future, I want to be a NFL Hall of Famer. And I want to like visit hospitals, like in my bye weeks, maybe. Maybe in college too. I want to achieve getting like maybe the first round pick in the NFL draft.
Dre's an aspiring quarterback.
Yes. I want to be a quarterback at University of Michigan. That's where my cousin is right now. He's playing football. And I want to get to the NFL, like probably visit kids in the hospital. Like if it's like Christmas time, if I'm not playing a game on Christmas, then maybe like give toys to the kids on Christmas. Or maybe like Christmas Eve or something like that.
So you're saying that you want to support
children
that are going through the same thing.
Yeah.
That's awesome. I will say I love that you want to help other kids too, going through. Do you do some of that stuff now? Do you visit hospitals now?
Yes. So he raised money, an organization that I learned about during the pandemic, which is a great organization because they have so much education, but also emotional support for parents. It's called Max Love Project. And I actually found it looking in the apps on my phone. To see if there was any like childhood cancer apps, and that's how I found this. Like they have some counseling services, but they also do a lot from a holistic perspective for nutrition, and this is not national but international. And Max, who it's named after, he had started donating these turtle nightlights years ago when he was diagnosed at 4. He's now a teenager who's thriving. So Dre has done that. There's another organization, the name escapes me because the organization closed, but he also had donated hospital gowns to our local hospitals. You donated non-slip socks. The past 2 years, our family has done like our own like third party flag football fundraiser to benefit like our local organizations. So, things like that. But, I've advocated on the national level with like childhood cancer action days with the American Cancer Society and St. Baldwick. So Dre's been on those calls with me advocating to Congress for childhood cancer funding. So
I appreciate you joining us to chat a little bit. Andre the Warrior. Like I said, I told you, really great name to get you through. That's going to be, I could see it in headlines now when you become that famous quarterback. But what team do you want to get drafted to?
Probably like a team like probably in Florida or California, like somewhere hot. Maybe the Dallas Cowboys or the Houston Texans.
I love how you have this all mapped out. I think that's amazing. And just, again, we're going to play this back and
he's a
be
very
like,
confident young
yes,
he's
yes.
always been, which we love his confidence, and honestly it helped him get through treatment, just his personality and who he is.
Yeah, don't lose that. Do not lose that confidence. But thank you so much for joining us and telling us your story, and appreciate it. So thank you so much for letting Dre join us. Is there anything else that you'd like to add that maybe we didn't touch on in addition to what we just spoke about?
I just want to thank you for the opportunity to, share, a story that's, it's been life-changing to us. But, the reason that, we're grateful to be here to talk about this is to help others. Because again, it is a life-changing experience. I appreciate you putting a spotlight on childhood cancer. Next month is Childhood Cancer Awareness Month. And, we hope that we see many different organizations, cities, states going gold for childhood cancer, because there's a lot more advancements needed, and there's a lot more funding needed for research. So thank you for shining the spotlight on it.
Of course. You honestly don't even have to thank us, because it's important, and we're here for a space for your story and stories like yours. So thank you so much for joining us.
Thank you.